The prevalence of non-fatal strangulation in Australia probably sits somewhere between 2 and 10% in the community. We know that it's most likely to be experienced in the context of an intimate partner violence relationship.
So try to actively screen for domestic and family violence. This could be the opportunity of being able to save someone's life.
Non-fatal strangulation is defined by any external compression of the neck and the structures within it. It can be due to manual compression with 1 or 2 hands. It could be with an external object, a ligature or a chokehold. It blocks off the important structures which provide air coming into the whole of your body. The arteries up to your brain. The most common signs and symptoms of non-fatal strangulation is the petechiae, which is little capillary hemorrhages above the site of strangulation, underneath the eyelids and inside of the mouth. Voice changes.
Pain in the neck, difficulty breathing. They may also include difficulty seeing and difficulty hearing, headaches and dizziness, and sometimes focal neurology. So that could be weakness in an arm or a leg. They might feel that both their short and long-term memory are affected.
Some of the complexities might include that actually there's no external injury that's present there, but there might actually be really serious internal injury. You might be seeing a woman quite recently after an incident, but actually symptoms and signs can develop hours, weeks later, months later.
The thing I teach GPs is to think about how to identify non-fatal strangulation and acquired brain injury, especially in the context of domestic and family violence.
We know that women might minimise symptoms or might not see the severity of it. It could be for multiple reasons. Fear, shame, maybe mistrust in disclosing that information. So it's important to be able to use the right language when you're speaking to a woman, because people have a wide range of interpretations of what things like strangulation, choking might mean. I might ask, if the patient feels safe in a relationship, if they've ever felt scared of their partner, then trying to find out a little bit more, like what they mean by feeling scared, and then to ask specifically about non-fatal strangulation, using language that's simple and general. So have you ever experienced a time where any pressure has been placed on your neck in any way?
What we'd like to see is that there's a single door into health. GPs need to have a clear referral pathway into specialist services, one that's seamless for the patient.
It could range from having referrals to counsellors, psychologists, or an ears, nose, throat specialist, a rehabilitation physician, social and legal aspects, or whether there needs to be a specialist domestic violence service involved. I really understand the pressures of a GP in trying to respond to a disclosure in a 15-minute consultation. It's difficult to do, but it is really important for GPs to still ask those questions. You might be the first person that a woman discloses to, and we know that it is a significant increasing risk of homicide for that woman as well. So it could save her life.